Hey, good evening. Or good day, depends where you are, I guess. But welcome to the Safety Meeting, part of the Provoking Safety channel. It's my channel, and believe it or not, I've been a little over a year now, I think 1 week, over 1 year, that I started this channel a while ago, and it was basically actually so that I could fill in the gaps and keep involved with safety stuff, even though consulting gigs and stuff like that was drying up with the plague, shall we say. Don't want to say that C word because YouTube gets all up in arms about it. So, yeah. But tonight, we're going to have an interesting talk, chat, presentation regarding COVID. Oops, I did it. But anyway, talking about vaccine passports, are they a workplace safety measure? Are they a justifiable hazard control? Or are they something else? And I decided to do this because there's been a lot of increased talk about COVID passports. There we go, I do it again. Oh well, about vaccine passports. And of course, they're called to be used domestically to access business and services. Now, realistically, we have to put this in perspective. Hotel owners, restaurant owners, gym owners, lots of business owners lost a lot of money during lockdowns, lots of this. So there's been a great clamoring with retailers and service providers to have the notion of a vaccine passport. Now, just to put it all in perspective and to consider, the use of international certificates of vaccination to travel abroad or enter another country, especially during outbreaks, is not a new concept. Believe it or not, I actually had one back in 1982. Long story, another story for another time. But so the notion of having them is really not anything new. But it's the notion of having to use a passport within your own country to travel domestically to access services, especially in a country like Canada. And really and truthfully, it's some people start to look at it as some sort of an approach to the brink of a dystopian society.
Your papers, please.
But realistically, this isn't all about that. In fact, well, I can take the tinfoil hat off. You can keep wearing yours if you want. That's up to you. But this episode isn't about that. It's not about conspiracy theories. It's not about where we headed. It's not about biblical prophecy, although that's an incredibly captivating and interesting subject, but of course not about tonight. But this episode, we want to take a look at the use of vaccine passports as a workplace safety measure and how they will work, or how they might work as a hazard control, or if they'll be effective at all. Now, keep in mind, employers are tasked with the duty by law to identify hazards and implement controls to eliminate or at least significantly reduce hazards. So there's lots of questions around vaccine passports as a true control for hazards around the plague. Or are they a different type of control? How do we monitor them? Or will the passports be monitoring us? Lots of questions, but the other one is, of course, there's a few more, but is this a gateway to requiring vaccination for employment? Is this a further dissolution and possible dilution of the rights that we have as workers, like especially I'm looking at worker safety rights, that many of us have been taking for granted? So let's jump in and talk about it in this episode. So feel free to jump into the chat, but on that note, thinking about it, let's talk about those chat rules. So first off, the simple normal ones. Participate. Questions and answers are all nice, so participate. Log into the chat. Introduce yourself. Like if I was to log in, I'd say, hi, it's Kevin here from Calgary. I'm a health and safety professional. However you want to do it, but participating in the chat's nice. Ask and answer questions. That's what these things are about, asking questions. None of us is born with this veritable cornucopia of knowledge. We've had to acquire it over time, and we have different levels depending on who we are. So your knowledge and opinions count, and the dialogue between chat participants is a good thing. But let's be civil. No name-calling, no insults, and of course, let's trade knowledge, not pool our ignorance. Now, the other thing is regarding the plague, YouTube has some pretty stiff penalties for misinformation and so forth. They've been pretty high on the with the censorship whip. So if whoever you are, doesn't matter who you are, no medical advice, no paramedical advice, nothing like that. And this isn't the place for it. The other thing is no vaccine shaming, pro or con. This is not the place. In fact, as a safety professional, I'll always encourage you to talk to your healthcare professional, your significant other, and make your choices that way. You wouldn't ask a safety guy to do your plumbing, so, well, I'm not a plumber either. So don't ask any safety guys for medical advice, and don't be giving any pros or cons with vaccines. Now, the other thing, of course, is no URLs, links, or any other kinds of promotion. Whew, now that I got that rough stuff over with, oh yeah, to log into the chat, you have to subscribe. I changed the settings. I know it might be nerve-wracking or miserable for some, but I'd prefer that if you subscribed, if you want to log into the chat. So just subscribe, ding the bell. That way you don't miss any content. You certainly don't miss a live stream. And then 5 minutes later, you can start chatting. So you go right ahead and do that. Now, before we get started with the vaccine passport thing, let's have a look at the news and things in the news. It's important to understand that health and safety doesn't necessarily, well, as I've said in a previous video or two, it's not sexy, so it doesn't necessarily get frontline news and headline news unless, of course, something bad happens. And so, yeah, let's talk about that. So, very first thing, this writer, and it's an opinion piece with the Toronto Star. One thing I've found in recent times is that with the internet, social media, things like Twitter, Facebook, etc., news is delivered to the audience in milliseconds and not necessarily by the news providers. It's from everybody. So I'm finding that with a lot of these news sites, many of them are aggregates for opinions. Not that it's a bad thing, but news happens so fast that opinion pieces are being, and commentary is being perceived as news. But that's my opinion. It really doesn't matter much. Let's talk about this opinion. Now, this person is reacting, but not necessarily in a bad way, to the incident that occurred in Kelowna last week with crane collapse. And by all admission, it was tragic. And 5 workers were killed in that accident, and 2 of them were brothers. So it's very tragic. It's catastrophic, if you will. Now, the problem, and the one thing that she points out here, she's from Ontario, is that really and truthfully, there's never any criminal prosecutions, but thankfully she does point out, and she's done her research, in that some of the provinces in Canada, notably Alberta, British Columbia, Nova Scotia, have already worked out a process where there's a cooperative effort between law enforcement and the occupational health and safety authorities in conducting the investigations together, and in case there's criminal prosecution. She does make a good point, though, in talking about this, and it's the idea of identifying hazards that I want to drive home, and the notion of what we call an accident. And health and safety professionals, we actually call them incidents. But a hazard is basically a thing, a condition, or procedure that has the potential to endanger workers. Now, employers, of course, are required by law to take every reasonable protection, or to take precautions and provide reasonable protection to the workers from known and potential hazards. That's why hazard assessments are the foundation for health and safety. So realistically, before work is done, all hazards should be assessed, and there are risks assessed accordingly, and then controls implemented. So really and truthfully, if a hazard is known but not adequately controlled, can you call that injury or fatality an accident? My paraphrase as to what she's pointed out. and absolutely right in that. And so the problem is, traditionally, the punitive action that has been weighed upon employers and company owners has not, in a lot of cases, been a deterrent, but fines are getting higher. They've actually exceeded, in most jurisdictions, $500,000 in some cases, but there are also now the ability, depending on the jurisdiction, for criminal prosecution. And that's what this person has done, is calling for that to be affected in Ontario. It should really be the case worldwide. If you're an employer and you're found negligent, criminally negligent, there should be a price to pay. Now, bear with me, I'm doing this for a reason. The next thing is, of course, and I will leave links to everything in the description after the live stream is over. I'll edit the description and I'll make sure I'll put links in, maybe tonight, maybe tomorrow. So check back and have a look. But in this situation, this is a case where two different owners or business owners in the UK were fined, and it says they were, the headline is this: they were sentenced following a fatal fall. Now, realistically, they're sentenced, but a worker got killed, and when you get right down to it, the fines were not that much. If you look, both owners were fined roughly the same thing, £6,318 altogether is what they had to pay, and then a $5,000 for a fine, £5,000, and then costs of £6,000. So together £11,000. So roughly, likely, I don't know, I'm not going to do the conversion, maybe $18,000 Canadian, each of them. But what's worse is if we scroll down and have a little bit of a look. This happened, but it was because they failed to install a scaffold gate, which would have cost about £40, so let's say about $70, and only takes a few minutes to install. Had that hazard been adequately identified, and it likely was identified, hence the fines and penalties, but there was no control put in place. So it's about identifying hazards and implementing controls that work and that you can verify that work. Now, whoops, that likely got transmitted over the stream. Apologies. But when we get right down to it, we have to consider it's not just the notion of looking for hazards and considering the controls, but it's also the workplace culture. And this next article, once again, I'll leave them all below, is about, how should I put this? It's about behavior-based safety. Now, if you're uncertain what behavior-based safety is, it's the notion that workplace errors and deficiencies are a result of worker behaviors and worker attitude. And, quite likely so that's a contribution, but what led to that behavior and that attitude? And that's what this author is pointing out. And in particular, what they've pointed out is, while they talk about how the fact that the feedback takes some time to get, there's often the expectation and reality meet in both places, where it's usually punitive action from the management, a penalty, and therefore the worker's not really motivated to participate in the health and safety management system. And that's a lot of truth. Now, to realize one thing, and this is about culture. When workers talk, people talk, word gets around. And so what happens is, if the same story is repeated for other workers, then it becomes a shared belief. Shared beliefs equal culture. That's how it works. So you end up with a workplace culture. And the author goes on and has some good points. But one of the points that they bring about is this. Oops, highlighting too much. My highlighter's not working. But anyway, is the idea to get workers involved with identifying the problems, but also coming up with the solutions to those problems and creating that culture of trust, belief, and in the organization and in the company owners. And then change starts to happen. And it's absolutely true. Change starts to be facilitated. And so between these two things, I'm talking about hazard control, hazard recognition and control, and affecting a good, trustful culture. And these, of course, this is twofold. One is, of course, I want to be using this as fodder or material for another live stream or a couple of live streams, but also it goes further to speak to tonight regarding if vaccine passports are actually a valid hazard control, and if so, how? And it's absolutely true. Like we need to know how they are supposed to be a valid control. Now, there's a lot of issues within this, and part of it, out of control, terrible tonight. Part of it has to do with the news. Now, we have to realize one thing. I would really like somebody to tell me if advertising revenue during the plague high points, if it was going up exponentially in news cycles as a result of the advertising dollars that were made, because I can guarantee a majority of the public was stuck to the news channels. Just a thought, just me being suspicious. But it's beyond that. It's how do we deal with this culture? We have to look at us as safety professionals. Now, one thing that we have to be is we are always working a balancing act. I will always say this, is that we need to be neutral and impartial, advocating for everyone within the organization. And in this case, we would be advocating for people to speak to their healthcare professionals. We would be telling them to consult with them and make the wisest decision based on good information. But we also have to weigh and understand the political demands of our employers and endure, in addition, put up with the fact that they have to endure the fickle tastes of the consumer and what's going on. Sometimes with the notion of woke culture and so forth, is that what are you doing to protect the public as a retail owner or a service provider or whatever the case may be? So how do we balance this as safety professionals in the face of worker concern over contracting an illness? Because that's what it gets right down to it. We need to be sure, and we need to know that we promote a safety culture that thrives on awareness from valid sources of information and ensure, regardless of what we think might be overkill by our employer or inefficient controls by our employer, that we support the employer and provide the best advice possible that echoes and mirrors and aligns with what the chief medical officers of health say in our jurisdiction and the occupational health and safety legislation says. So basically, we have to take into account everything that works properly and is working within the legislation to make our decisions. And that's just the absolute truth, no matter what we do. So let's jump in further. And just like the little stinger said, leave a comment. I appreciate comments. Jump into the chat, say something, whatever the case may be. And it isn't necessary to agree. You're welcome to disagree by all means, but just let me know why. So it's important. First off, number one, let's dig into this further. Let's consider what a control is. Now, safety controls are processes, practices, systems, policies, tools, all sorts of things that are designed to reduce risks to safety. In fact, the ideal goal is to eliminate risk altogether and to make sure that workers aren't harmed. Another way to think of it is in terms of occupational health and safety. It's a control is a type of intervention used to manage, direct, or mitigate a workplace hazard. Often people have said, and workplace safety gurus have said, that a hazard is basically uncontrolled and undirected force. So you have to have a good hazard recognition and control program in place. And I know you're going to say, what's that, Kevin? This is a bit long. I took it from the Canadian Centre for Occupational Health and Safety, which is a very good go-to for health and safety information. They've got a lot of inexpensive courses that are quality courses online. So I recommend, if you're needing to do some learning, by all means, head over there. But hazard control program consists of all the steps necessary to protect workers from exposure to a substance or system. The training and procedures that are required to monitor worker exposure and their health to hazards such as chemicals, materials, or substances, or other types of hazards such as noise and vibration. A written workplace hazard control program should outline which methods are being used to control the exposure, and this is the key thing, and how these controls will be monitored for effectiveness. I can't say this enough. You cannot just put a control in place and hope it's going to work forever. And that's been part of the issue since March of 2020, pretty much, is that the idea of firing controls and layering controls and unsure of what control does what. Not only that, the media really hasn't helped us a whole bunch. Let's see if I can just bring this one up here. I'll get rid of this one. And here's a good example. Now, I don't mind Fox News. I like Fox News. I find it entertaining a lot of times and a good alternative. What I usually do is I take a couple of different news sources and then I go and research myself if it's something of concern to me. If it's who's in the White House, don't much care. But Fox News is in the news because they've been very outspoken on a lot of things, and especially a vaccine passport, yet in the same token, they're requiring all of their workers to identify if they've been vaccinated or not. However, as the article states further down, and I'll leave it in the links, Fox is also saying it's so that they can accommodate them. And in which case, we have to remember one thing. If you're doing it for the purpose and questioning your employee about their vaccination status for the purpose of accommodation, then you do have some legal standing. However, once again, not a lawyer. If you're an organization and you want to go down that route, I would suggest that you talk to your legal counsel first. Don't ask a safety guy. I do safety. I don't do law. Not a lawyer. So, we've talked about what a hazard is and what controls are and a hazard program, and the last part of it, of course, monitoring the controls for effectiveness. Now, part of that notion, too, when we're monitoring the controls and considering effectiveness, is we have to be mindful, of course, of what the experts say. But therein lies the problem. Experts have been divided. Part of the problem is, as I've said it, the news consists of a couple of things. It consists of actual news. It also consists of commentary, and it consists of opinions. Those last two almost there's really a thin line between them. But therein lies the problem, because you go to trusted news sources. And so we're going to explore a few of those as we move through this. Now, as I've said, the vaccine passports themselves are getting a lot of buy-in from different groups. And a lot of them see it as a necessity. In fact, there's been opinion pieces written on both sides, pro-vaccine passport and anti-vaccine passport. And really and truthfully, what do we do? How do we approach this? And we have to consider exactly what the cost is and what's the process. And of course, part of the problem is what does our Constitution say? And that's, once again, down a whole line that I have really just a passing familiarity with. But is this control that we implement going to cause a loss of control elsewhere? And I'll just close this for a second. As I said, I just wanted to show you the headline that Quebec's vaccination passport plan threatens to infringe on freedom of movement, an expert says. And you know what? Entirely possible. But the problem is lockdown measures did so much to businesses that they're clamoring for a solution. But the question is this out of fear? And a recent interview and article from CTV, which I will leave in the description, is the need for immunization cards or vaccine passports to be used domestically. As this bioethicist, or that's a really difficult word to pronounce, but who's assistant professor at the University of Toronto, says this may be a sign of fear on a part of the population, that if they don't have this, they're really going to have restricted lives. So we have, once again, a division. And on that note, he goes on to say something else too. There's this anxiety that everybody's going to need a passport. And he says he's not sure if we're going to need any. And this is the big thing. He says the last thing we need in this challenging, difficult world is to divide people. And that's the absolute truth. Because what we're going to be doing is we're going to be dividing workers. We're going to be dividing workers into the vaccinated and the unvaccinated. And we're headed down. Like realistically, we always think that we should progress in history. And I just found this little clip. In some cases, it might be amusing, but I want you to think about it for just a sec. Unclean! So, what road are we headed down? Now, a couple of other things to consider when we're looking at controls. Just a quick review of controls. I'm just going to get rid of this quote. Is they fall under 5 categories. You have elimination, which is we get rid of the hazardous thing altogether. Substitution. We substitute the hazardous thing for something less hazardous. Engineering control, where we put a barrier between the worker that's endangered and that dangerous force or the hazard. And then we have an administrative control, which basically instructs how the worker acts or provides different time shifts, etc. So it basically lays down a foundation of how the work is going to take place. Usually administrative controls are written documents, signage, and also instruction and training. And then finally, of course, PPE, which is the lowest on the hierarchy of controls. So which is the vaccine passport? Which kind of control is it? And realistically, right now at this point, it looks like, at first blush, it looks like it's, I would say, elimination. We're working to eliminate those that aren't vaccinated because the notion is vaccination reduces transmission. Now, a couple of things about that. First off, let's look at this article right here. I'll just open it up and make it a bit bigger so you can see. So this is latest, and it was, just this year, just this week, I believe it was yesterday. Now, well, we can look at the time here, or the date. July 22nd. So yeah, a few days late, but that's fine. Now, the notion is that with Israel was doing well. They used the Pfizer BioNTech vaccines, and they were doing well with a majority of their population being vaccinated and the vaccine being well over 90% effective against the infection. Now, the New England Journal of Medicine found it to be 88%, so I'm not going to mince words or anything as far as that goes. But there's a couple of other things to consider here is the fact that, and if we look at this part right here, the Israeli statistics also appear to paint a picture of protection that gets weaker as months passed after vaccination due to the fading immunity. People vaccinated in January were said to have just had 16% protection against infection, while those who are done in April have an effectiveness of 75%. So what we're seeing is from January to July, it went from 90%, 90-something percent, down to 16. So a loss of over 70%, we'll say 75%, 3/4 of the efficacy was lost. So how long are vaccine passports going to be valid? How are we going to monitor these for effectiveness? If we're going to use them for control, then employers have to be monitoring them for effectiveness. I guess they're just going to say, oh, well, nobody got COVID, I guess we're good. And in which case they could likely be right. But what are they going to do if these people that were previously vaccinated all of a sudden contract COVID? And for whatever reason, because they also have an undisclosed comorbidity, they contract COVID-19. Now, is their control working? Is the vaccine passport working? I don't know. It's very hard. When you implement a control, you have to monitor that control. In fact, I've seen employers receive notices from different occupational health and safety authorities for not monitoring controls that were put in place, such things like fume hoods, for instance, that were expired and not working and ineffective. And so the employer ended up having a written notice because their controls that were in place weren't working. Same thing with the extraction devices like Niederman arms, etc. So if we're going to say that the vaccine passports are control, how are we monitoring that control? What's the case? How are we doing it? So does it become a control, or is it a worthwhile control? Now, one other thing to note here, as I said about people being divided and unsure, I'll leave this link in the description, but a lot of very conservative groups such as Johns Hopkins, who are pretty much, well, I mean, most people know who the Johns Hopkins University Hospital is. And so they are very conservative when they're saying, in fact, what they say is the mRNA vaccines are likely to reduce the risk of virus transmission, but probably not completely in everyone. This is one of the reasons why it's still important for people to continue wearing masks and practicing physical distancing even after being vaccinated. Now, of course, we also know that masks are a point of hot debate as well. We have to agree on that. There's it's polar opposites. It doesn't matter whether you're Fox News or CNN. It doesn't matter. There's polar opposites with the acceptance of masks. Physical distancing, with both masks and physical distancing, if you think about just merely the physics, and I did a video on it, and I'll leave a link in the description, realistically, the physics behind it does say that as a transmission vector, masks and physical distancing will reduce it. That's just plain physics. But the concern here is, who are we to consider, and whose authority do we take? What do we do? Do we pay attention to a narrative that matches our employers? Possibly we're going to have to go down that route, but is it the right thing to do? So whose science is right? And that's where I better check. Am I still streaming and YouTube hasn't cut me off yet? Oh, yay, I'm still on. Good stuff. So there's a lot of additional questions that have to be asked. Like, number one, is it lawful for business owners to require V-ports? Yeah, vaccine passports, V-ports. You heard it here first. But I'm not a lawyer. Really and truthfully, some of the comments that have been made, and I've got other websites that I can lead you to, but I'm getting on in time here and I don't want to use up your time, is that society too is divided with that on what we should do. Really and truthfully, the law is that a business owner can turn away who they want, provided it's not an infringement on human rights. And of course, that's been hotly debated as well. Ban a president from social media platform, but refuse to bake a cake and see where that gets you. So private companies, as long as they're not discriminating on human rights, have the right to say what they want. But incidentally, it's something important to note that Seneca College in Toronto recently put out that it's just plain and simple. They're being accommodating. At first blush, a lot of people will take this negatively, but unless you've fully vaccinated as faculty, students, or staff, you're not coming on campus. But what they've done is they've also said that faculty that can teach from home, students that can learn from home have the ability to do so, and you're going to have to make your choices forthwith. And understandably so, got that. And once again, it's, I guess, their prerogative. As I mentioned in a previous live stream, that there will be employers who are going to just say, I'm going to do what I'm going to do, and I'll take the lumps, the legal lumps when I have to, and deal with that when the time comes up. Possibly. It's all hard to say. Now, getting on to the next question, of course, is what about employees? If we're going to require the patrons or the consumers for these services, whether it be a college, a restaurant, or whatever the case may be. We talked about the college, but what about restaurants? What about gyms? What about movie theaters? What about any places where people are going to gather and do stuff that's not considered an essential service? And we require them to have vaccine passports. What about the employees? And there's a couple of things that are to note here. One of them is what Quebec has said, and they have said this. Employers will not be able to require one as hiring criteria. And that's great. Just hang on, got to get a drink of water. And that's the current law. But is that law going to change? That's what we need to know. Another site here. Whoops. Oh, they're going to be mad I didn't register. Anyway. Mondac, who's an HR and legal site, they make one important note here that's something to be of consideration. And that's with the privacy commissioners and what they've been talking to. And it's this. And the privacy commissioners have said, we have not yet been presented with evidence of vaccine effectiveness to prevent transmission, although members of the scientific community have indicated that this is forthcoming. And so we have Johns Hopkins, who says it's not necessarily, they're not sure yet if it prevents transmission or not, and they're not ready to go out on a limb and say it. And it's the same. Science is divided. So where can we affirm this efficacy of it being a valid control? Now, don't worry, getting to a close here. And so the thing is this going to possibly lead to it being an ineffective control? If we're not going to require employees, then why do we require patrons and customers and the public? And so, because if we're doing that, is it kind of like maybe only having half a shield in front of your face and we just got to hopefully duck with this side? I don't know. Also, let's consider what occurred during the height of the plague, with a lot of business owners just deciding that they couldn't afford it. They were going to open up and deal with the fines and the penalties and whatever. So are we going to run the risk of having an underground economy or some other method of skirting the regulation? You know what? That's even worse, because then you know what's going to happen? We also might have instances of employers skirting valid workplace safety monitoring that's going on against actual issues. Not saying that COVID-19 is not an actual issue. Oops, said the C word. But as I mentioned earlier, we have had instances or an increase in workplace deaths in a lot of jurisdictions, even though there was a reduction in the workforce due to the plague. So why is that? And possibly it's because of ineffective actual workplace monitoring. So now the question is it, and I still maintain, is it an effective control? And if so, how's the efficacy going to be monitored, tested, and what are we going to do about it? And especially if we're relying on vaccine efficacy, which is currently, some studies are showing that the evidence shows the efficacy is waning. So the next thing, If it's not an elimination control, it's certainly not a substitution control. What kind of control is it? It's not even an administrative control because it doesn't work like that. So here we are, full circle, kind of like a dog chasing its tail. Now, the other concerns, the privacy, the arguments. And you know what? I even notice, and this has to be one of the stupidest arguments I've ever seen in my life. And a doctor, a medical doctor, a real medical doctor was on Twitter, and she said there is no reason that vaccine passports, V-ports, shouldn't be allowed. My driver's license has my eye color on it, so what's the big deal? The reason that is stupid is because people, unless you're wearing sunglasses, can see your eye color. Okay, it's not as though it's private. It's in public view. It's not private. But let's consider all of the security breaches and all of the current data that's been going on and the ineffective use of it. I just have a quick look here. Here's Wikipedia, and it's a list of data breaches. Yeah, I'll leave the link in the description, but I'll just cruise through it. And yeah, and it's not as though some of these go back to the 60s, folks. A lot of these you'll read are even this year. There's a ton of data breaches. And you know what? Let's look at it this way. If you have one door in your house, maybe two, you only need to think about locking two doors. But if you install 2, 3, or 4 more, now how many do you have to worry about locking? And the next thing is, where'd you put your keys? You know, like how many of you have lost passports? I just have this concern of really and truthfully, what are we looking at with these V-ports? Now, the next thing, of course, is you have to consider that many organizations would likely pay dearly for this data that shows consumer movement from place to place to place, where this QR code or whatever it is, and by the way, if you look at the thumbnail for this video, the QR code will take you right back to my YouTube channel. I thought it was brilliant, but anyway. Now, many organizations would pay for this data showing consumer movement. I mean, air miles is a thing, guys. So is almost any kind of loyalty reward you get. That's all it's for, is tracking your data. So considering the amount of breaches that have already taken place, things like the CRA hacks, etc., really and truthfully, do we need another methodology or another place that can be hacked? Now, honestly, if there's a verifiable reason to have V-ports, it's catching on, I know it is, and they're a control that will work, and there's evidence that shows it. Right now it's not clear, then let's implement them, provided they don't do things like infringe on human rights, infringe on the ability to travel and get necessary services, jeopardize privacy, prevent people from seeking employment, or prevent valid necessary trade. So on that note too, is, like I said, if we're going to be, if provinces and jurisdictions are going to be looking at changing labor laws so that employers can require employees to get a vaccine, what about these very rare cases where one of these bad reactions occurs, and whether it be myocarditis, pericarditis, or a combination of both of those, or any of the other things that have occurred, is this now a compensatable claim? Keep in mind, it took decades for firefighters to be allowed to have things like throat and mouth cancer and things that they contracted through the course of their work as viable and compensatable claims. So really and truthfully, what's going to happen here? Just a question. I'm not a lawyer. So what do we as safety professionals do? Once again, just like I said at the beginning, we need to be neutral and impartial, advocating that everyone consults their healthcare professional about their healthcare matters. If our employer wants to align with a good vaccination awareness program, then we should be promoting it. But understand the political demands of our employers that they endure, like in the fickle tastes of the consumer. We have to have a good balance. We have to balance the worker concern for contracting an illness, promoting a health and safety culture, but also one that thrives on awareness from valid sources of information, and ensure that regardless of what we do, that we look after our employer. We provide that employer the best possible advice that aligns with that of the chief medical officers of health of the different jurisdictions we serve and current occupational health and safety practices. Now, of course, and this is, I'm just winding down, all of this may change. This may be an unnecessary conversation. Quebec is considering following their counterparts in France, where the president is mandating vaccines in a lot of cases. The UK is looking at mandating vaccines. If you've been watching the news, there's been lots of unrest all over Europe in a lot of different places. The US president is appearing to favor the same notion, talking about going door to door, and that just scares me. And not only that, some 120 different medical groups in the US have called for mandated vaccines. So realistically, at this time, they're talking about mandated vaccines for select groups, but I have no doubt that this selection will broaden. So will V-ports be a thing? Trying. You know what? I hope not. But would I bet on it? Absolutely not. So, as I can see, there was nobody in the chat. And that's okay. Understandable. Possibly the note of having to subscribe scared people away, but that's okay. I want to thank you for joining me this evening. And I want to talk about, in the next session, transforming workplace safety cultures, improving them, resurrecting them, or maybe even creating one where it never existed before, and some tips on how we may do it, and how you as a safety professional or a person that's concerned with health and safety, how you might go about doing it. So until we see each other again, and you know what? I really hope we do. I really hope we do. Do me a favor. Don't just think about safety. Make sure it's on the forefront of your mind, but don't just talk about it either. But lead by example. Become a safety influencer. Provoke safety. Live it out. Do safety wherever you end up. Anyway, thanks. Take care. Bye for now.